Hi, I'm Dr. Robert Lin, founder of IQ Laser Vision. I'm here to tell you today a little bit about some of the most commonly asked questions about SMILE. After reviewing your diagnostic test results today, our surgeons feel that you're a good candidate for SMILE. You are at a low risk of significant complications from the procedure, and therefore he feels like he can achieve a great visual result for you. The SMILE procedure takes about 5 minutes per eye. While lying on your back, we'll numb your eyes with drops, after which one eye will be held open with an eyelid speculum. And you'll be looking at a blinking fixation light, which you'll feel a gentle pressure on your eye for about 30 seconds. And following this, you'll be aligned under a brighter microscope light. And then you'll feel the surgeon move around your eyes a little bit of pressure, but no pain whatsoever. And then we will remove the eyelid holder, at which time you can freely blink your eyes. You don't have to worry about blinking your eyes because your eyelids will be held open securely. However, it's very important for you to kind of look into space and kind of blank out and zone out into space and not to follow the green light, which will be flashing. Your surgeon will coach you more during the procedure. The majority of our patients experience very little discomfort at all. There's a little slight pressure for about 30 seconds during the creation of the lenticule. Some patients may feel a little pinching sensation or a little irritation from the eye drops, but in general, it's a pretty comfortable procedure. If needed, we can provide and offer our patients a mild sedative, usually Xanax or Ativan, prior to the procedure. This will make you feel really relaxed. And with the combination of this and also the numbing drops, you're going to do great. The recovery is pretty quick. So with the SMILE procedure, that's a great thing because there's no LASIK flap and there's very small opening. Most patients are actually very comfortable. You might feel some very minor irritation for an hour or two, but go home and rest. If you feel pretty good, then you can probably do most activities. You'll be back to full activity within 24 hours. Most people are going to function pretty well after the surgery. I tell patients that you're going to be around 80% of what you normally see with your best glasses and contact lenses. And then in about 2 weeks, you'll get to about 90%. It does take up to 6 months to get that final 10% because it takes some time for your brain to adjust to the new signals, just like you're getting a new pair of glasses. After we've determined that your prescription and the eye health is adequate for us to proceed, the next post-operative appointment after your procedure will be 1 to 3 days after your procedure. Typically, our patients will do 1 or 2 more tests within the next 12 months. Most of our patients are able to see 20/20 after the procedure. With the SMILE procedure, over 95% of our patients will achieve 20/20 or better vision. A lot of it depends on how well you could see before the surgery with your best glasses. But most people can achieve 20/20. Some patients actually achieve 20/15, which is better than 20/20. The great thing about this procedure is that we are permanently reshaping your cornea to correct the prescription. This is a long-term procedure. LASIK or SMILE does not wear off. However, it is possible for your own prescription to change because your eyeball got longer or the lens in your eye has changed. If that happens, we can usually do a LASIK or PRK procedure. However, if the patient is having lens changes, then we may need to do a lens-based procedure to correct that. Halos and glare is a very commonly reported side effect after any sort of laser vision correction. Fortunately, most of these experiences happen immediately after the surgery. So I like to tell patients that it's normal part of the healing process for you to experience a little bit of halos and glare at nighttime for the first few months after the procedure. However, after 6 months, most patients actually feel like their night vision is actually better than what they were seeing with their current glasses or contacts. That's a very good question about dry eyes. So I like to tell patients, the most drying thing that they can do is actually continue to wear their contact lenses. And because there's always a lack of oxygen nutrition to the eyes, and there's always little scratches on the cornea, which can lead to infection. Now, with the LASIK procedure, there is reported temporary dry eye symptoms up to about 6 months. The good thing about SMILE is that the procedure makes a much smaller opening and there's no LASIK flap. And typically, patients experience only a few weeks of temporary dry eye symptoms. In rare situations, you can have dry eyes than before the surgery, but that's very, very rare and in less than 5% of patients. But then it's very, very mild and usually much better than when you're wearing your contact lenses. Most people, the reason they don't do eye surgery is that they are concerned, what if they're that 1 in a million and they go blind from the surgery? So fortunately, all the treatment we're doing with the SMILE and even with the EVO ICL is on the front area of the eye. So in the case of SMILE and LASIK and PRK, it's on the cornea. So typically there's a very good solution to help improve vision if there is an abnormal healing process or response. LASIK and SMILE and PRK, which are corneal-based surgeries, and there are over probably 40 million procedures performed over the last 30 years. There's been no reported cases of blindness from this procedure. At IQ Laser Vision, we've been one of the pioneers of performing SMILE in the US, and we've performed close to 25,000 procedures. So all our surgeons are at the top 10 surgeons throughout the whole US in terms of experience. And our track record is a very low enhancement rate, and also published studies from our center have demonstrated over 95% of our patients will achieve 20/20 or better vision, which is phenomenal. Yeah, the next step is after we determine your candidate, meaning that your prescription has not been changing. Now, there's a little confusion about changing prescription. There could be variations of your measurements, which doesn't mean it's necessarily changing. However, if you have fluctuations, we just have to determine that we have a good measurement for you. Your eye health has to be really good, not a lot of dryness. The cornea has to be smooth, no evidence of weakness. If there are evidence of weakness, then we may need to do a procedure called EVO ICL, which does not remove any tissue. But for the most part, SMILE and LASIK is very safe, and if the cornea has a normal shape, we can proceed with your procedure.